Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. As always, I am your host, Dr. Jay Warren. I am a family wellness chiropractor and wellness care coordinator here at the CAP Wellness Center. And today we have back with us Kimberly Johnson. She's been on our show a couple of times. She's been on doing an episode about pelvic floor issues. And then also the second interview we did with her was about her sanctuary plan for the postpartum period. And we have her back today to talk about something that's really important and something that challenges a lot of women postpartum, and that's prolapse. She's going to share her knowledge and wisdom about this issue, all the different types and all the different cases, to see if you can heal a prolapse yourself. Many times women are just given the information that it's either a surgical case or not bad enough yet to be a surgical case, and there's many more options. So she's going to share that information with us today. But before I bring Kimberly on, as always, I want to take a moment to thank our sponsor, the CAP Wellness Center, who makes this podcast possible. The CAP Wellness Center in Encinitas, California, has assembled an incredible team of fully certified health practitioners that offer the very best in prenatal, postpartum, and pediatric wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. So for those of you that have not heard Kimberly on our show before, or if you'd like a little review, let me read her bio and then bring her on. So Kimberly Johnson is a certified sexological bodyworker and a near-certified somatic experiencing practitioner. She's also a single mom, a doula, a Rolfer, and a yoga teacher. She leads workshops internationally and virtually on the intersection of women's sexuality and spirituality, as well as holistic postpartum healing. After living in Brazil for 8 years, she now resides in San Diego, California, where she has a private practice specializing in birth injury, birth trauma, and sexual healing. She's an absolute expert in postpartum care for women, so let's switch on over to the conversation that I had with her about prolapse. All right, Kimberly, welcome back to the podcast.
Thanks, Jay.
How are you doing today?
I'm doing great, enjoying the rain.
Yeah, it's a little bit of a change here in San Diego, so we get to enjoy it, actually.
Yep.
And today we're going to be talking about prolapse. It is a topic that I know we get a lot of questions about in the Wellness Center, and I know there's just a lot of women all over the country that are curious about it, concerned about it, want to get more information about it. And I think what my experience has been like, and what Kimberly, you and I were talking about beforehand, is a challenge is that there's so many questions and women don't know where to go to get answers, and there's a lot of misinformation. And what I really want this episode to be about is for you to really kind of dive into the subject, say like what it is, what it isn't, how to recognize it, and then even more importantly, what they can do about it. So I thank you for coming back and sharing your expertise on this.
Yeah, I look forward to it.
Good. So before we even get started into the topic, for those listeners that haven't heard you on our podcast episodes before, you've done 2 with us so far. Would you mind giving a little bit more of your background, a little bit beyond what I just read in your bio, just to give some context about how you got interested in this work before we dive into the topic?
Sure. My life changed completely when I became a mother 8 years ago now. My sense of my body, my own personal movement practice, I was a yoga teacher, my relationships, pretty much everything as I knew it changed in a way that I was totally not expecting. And as a result, I had a pretty difficult postpartum recovery, and I traveled all over the world trying to find out how I could avoid pelvic surgery. Basically, I was told I needed a full pelvic floor reconstruction. And as a result, I found some modalities that I just made huge leaps with those in my own healing and recovery process. And now I'm 100% recovered, and I spend my time and my life trying to help other mothers and women both avoid birth injuries and recover from them.
Fantastic. Well, I think that's going to be an important part of things, is like what women can do to help prevent this issue from coming up. But let's talk specifically about, terminology and definitions and symptoms and stuff before we dive into that. So when a person is either Googling prolapse or concerned about whether they have it, or trying to ask their practitioners for information about it, what specifically are they most likely talking about?
So the symptoms that a woman might feel if she's suspecting that she has a prolapse are a feeling of heaviness, a feeling of fullness in the vagina and in the pelvic floor. Some people say things like, I feel like my labia are dragging on the ground, or it feels like my insides are falling out. Those are the main sensations that go along with prolapse.
Okay. And that's something is that something they'll feel right away after birth, or is it something that can take time?
Great question. Most of the time people don't feel it right away. And a big cause of it is often women feeling pretty good post-birth, or just having other kids that they need to take care of, exerting too much in the early postpartum, and then later on down the road, 3 months, 6 months, 9 months, having a prolapse and feeling like it's unrelated to birth. But if they looked back at the trajectory, they only took 1 week off, or they only stayed in bed for 3 days, and then they started running at 6 weeks or something.
Okay. Is it something that maybe that if you want to call it damage, did occur postpartum rather than just the delivery, or are you saying it's a combination of all of those things?
It could be, you could come through the delivery intact and then have the prolapse happen postpartum, because the ligaments are so soft and loose. No one who has a vaginal delivery has full pelvic floor strength within the first 2 to 6 weeks, based on hormonal changes and ligamental shifts. And then if you imagine, lifting a heavy weight without a foundation, and even a baby if you talk to most women, even if their baby's small, it's hard to lift a baby after a vaginal birth or a cesarean birth when you don't really have abdominal muscle and pelvic floor function happening. So, I work with people who, it's also possible, like you said, there's a much higher risk of prolapse if there's vacuum extraction or forceps delivery. If someone's done a lot of the pushing phase of labor with a full bladder, that can be a cause for prolapse. And then, like I said, it can be just not enough rest postpartum and too much time standing, and then that causing the ligaments to stretch so that the organs aren't suspended where they need to be and they start to drop down.
No, that's interesting. I had no idea. I had always assumed it was just specifically from the birth process. No, it's not. It can be either. It's pretty common that someone comes through the birth feeling fairly intact with, it's hard. Prolapse is something that would be hard to assess right away, just because the organs aren't in their normal place and their normal size right away after birth. But even so, I know quite a few women who were feeling pretty normal from 2 to 4 weeks, 4 to 6 weeks. I know someone who is a client of mine in Brazil who had her third child in Holland. She had 2 cesareans and then she had a VBAC, the third delivery. And in Holland, you get a person who comes to your house every day for 11 days and helps you with your other children and helps you cook and do basic stuff. Wow. But after those 11 days, she was on her own because her husband was traveling, and she was climbing up a ladder at 11 days postpartum and picking up her other kids who were toddlers. And then she experienced a prolapse. Wow.
So that was a third delivery, but not even a third vaginal delivery.
Right.
And just exertion too soon.
Right. Well, because I mean, and as far as the ligamentous changes, you're talking about with the effects, the after effects of relaxin still in your system.
That's right.
Yeah, because most of the time women are asking me, when can I get back to exercising? And, the conversation I have around relaxin is around kind of ligaments as far as structurally doing exercise. But I hadn't really, thought of that being something that could affect a potential prolapse. So I'm really glad that I'm learning this.
Totally. And, it has a lot to do with someone's already base level collagen elastin mixed in their connective tissue. Right? So if somebody has really elastinous connective tissue to begin with and maybe a low collagen density overall, then those ligaments are already going to be prone to stretching. Or you could even think about somebody who's like a long-time yoga practitioner who mostly does work in that direction of elongation, then they're going to be more prone to prolapse.
So I guess another question that comes to mind is, in talking about prolapse, are we specifically talking about bladder prolapse, or are there other types as well?
There's 3 main types of prolapse. So there's a rectocele. That's a rectal prolapse. So when the rectal wall starts to push into the vaginal wall is one kind. That's in the posterior, like the back part of your pelvic floor. Then there's a cervical and uterine prolapse. So that's what most people would call. You can technically have a vaginal prolapse, but most of the time when people say a vaginal prolapse, they're talking about the cervix dropping down farther into the vaginal canal. Okay. And then there's the bladder prolapse, which is when the bladder's falling down. Usually the bladder should kind of sit near the pubic bone, and sometimes because of the postural position of the pelvis, together with other factors, it'll slide down.
Okay. Is one more common than another?
You know what? I don't know. I'd say I've been dealing. I don't have a large enough sample size to really trust my statistics, but I deal more with bladder and rectal than I do with cervical.
Okay. All right. I was just curious to see if there was, a predominance of one more than another. And so we talked so we now know like what it is and the common symptoms that a woman would feel. What's the main causes of these things? Because then that's going to allow us to be able to talk about preventative measures.
Yeah. So the main, so we can't know 100%, but we do know some things. That if you are in the pushing phase of labor and you're pushing against a full bladder, that's a contributing factor to a prolapse. We know that interventions like forceps and vacuum extractions lead to prolapse often. And then the other things I mentioned about not enough postpartum rest, exercising too soon right away, lifting heavy things.
Right. So that's something, as far as like the full bladder, it's making sure you have an empty bladder while you're pushing.
That's right. Going to the bathroom during labor. If you happen to be laboring in bed because of an epidural or whatever, making sure that there's catheter and you're emptying the bladder during that time. And then the other the vacuum extractions and forceps delivery, that's kind of a whole other conversation.
Right.
But as far as the postpartum period goes, then we're talking about really respecting those first 40 days, minimizing any kind of exertion, staying, for the first, the midwives say 5 days in the bed, 5 days on the bed, 5 days around the bed. I think that a lot of women see that as old-fashioned, and it's very hard for most women to rest that amount of time since we're all so active. But hopefully in a podcast like this, people get the information that it's not just, it's actually for health and not just your life force. Because some people will be like, oh, I'll just drink a cup of coffee. I know I'm going to be tired, but I want to get this or that done. But actually physical injury. And I find that, prolapse is a birth injury. It's an actual injury. And I hope that together, you and I and, CAP Wellness Center and other people that we work with can really do a good job about not scaring women about birth injuries, but also having people be informed about them, because a huge part of the healing process is letting go of the shame around it, because, prolapse doesn't mean that there's incontinence, but those can sometimes go together. It just feels strange to have such an intimate and sexual part of your body be so different than how it was. It affects relationships. And so it's hard to talk to a woman in her third trimester about birth injuries because you are trying to prepare them for positive outcomes and not use scare tactics. Sure. At the same time, many women postpartum feel very disillusioned because they had no idea that an injury was possible through birth.
Right.
So it's not just the actual injury that they're suffering from, it's the disillusionment of like a culture of secrecy around women's health and what a reality could be based on certain decisions that they make or don't make. Or like, some women tell me, well, no one told me not to run. At my 6 weeks checkup, they told me that everything was good and I wanted to get back in shape. So I started running because I've always run. Right. And I get that. And I know from experience that jumping and like hard impact like that on a soft pelvic floor with, especially if someone's nursing, so that relaxin is like really pumping, and you need that in the body. It's just that long-term thinking that we have to encourage so that the organs can be intact before returning to vigorous exercise. There's plenty of exercises that are fine, like swimming is great. Even an elliptical machine is, okay, as long as you're not too heavily relying on the handbars and you're using more of your center to make sure that you have the balance and the stability to be generating that motion. But you'll find that a lot of people, once they have prolapses, they're uncomfortable walking or being on their feet for any length of time.
Right, and not all, but that could be prevented if you ease into those things postpartum that much easier.
That's right. Mm. And the other thing is that, I work with women who have prolapses, let's say. So prolapses are usually rated in degrees from 1 to 4. So stage 1 prolapse, stage 2 prolapse, stage 3 prolapse, depending on how far those organs have dropped down. And like everything, like you and I know about back pain, there's people whose back, if you looked at an x-ray, the x-ray looks terrible and you think the person was in terrible pain and they're not in any pain. Right. And then you look at someone else's x-ray and their x-ray looks pretty good, but they're experiencing tons of pain. So we don't really know how pain and symptomology works together with what we're in the anatomy. But I do work with a lot of women who are experiencing a lot of anxiety postpartum, which is normal. And that anxiety, when you're alone most of the day caring for a new baby and you're feeling physically disoriented, then if there is a problem, that problem becomes an obsession. That problem becomes where the attention is focused the whole time. Like, am I ever going to get better? Is this ever going to feel different? Have I permanently damaged myself? I'm sure that you hear a lot of those questions too.
Yeah, absolutely. And having information like this would allow them to take action in a different way, and hopefully take action before it ever, becomes an issue.
Yes.
Is it something where, I know your work definitely is not just physical, and so you just started talking about that kind of emotional component around the anxiety around it, but then also going into like birth trauma. So can you speak to that component of this issue as well?
Yes, well, one of the recent cases that I worked on was someone who had a stage 2 prolapse, and she'd been to physical therapy twice a week, I think, for 4 months, and she hadn't seen any results, any difference at all. And she actually had an OBGYN who was pretty informed, so he had sent her to the physical therapy, because what I hear a lot of is doctors saying, oh, it's just a stage 1 or stage 2, live with it, come back next year. If it's not better, then we'll do something about it, meaning like put in a mesh pessary or do surgery. But prolapse is, okay, well, first of all, so in this particular case, in her second session, while I was doing the hands-on work, she returned to a moment from her birth scenario where she had dissociated and she could see herself in another part of the birthing room and she could hear what the nurses were saying. And as I used the somatic experiencing process and trauma resolution skills with her, and she was able to blend who she is here and now with that other aspect of herself that had dissociated and separated, after that session, her prolapse resolved.
Wow.
So it was, I mean, I consider it to be sort of the magic of hands-on work together with the nervous system resilience. But it was very pronounced result. And I have noticed, and one thing that can be really frustrating about prolapses is that it doesn't always, it's not like, okay, this person has a prolapse and then they go for a walk and that day they feel the symptoms more. It can feel very random, and that's frustrating because women are trying to understand, oh, well, is it the walk that caused it to be heavier today, or is it the this that caused it to be heavier today? And there's not always a rhyme or reason. When you're dealing with birth injuries, it's often not a very quick recovery process. You know, this woman that I worked with, yeah, okay, I got a result after 2 times, but she'd already been in the process for 4 months of trying to seek out help and, you know, so,
yes.
you know, I really, for some women it resolves quickly, for others it takes a longer time, and I do notice that it tends to walk in tandem with the overall recovery. So it's not that those are separate. You can't separate the mind, the body, the sexuality, the spirituality, the relationship. They're all together. But the extent to which, and it goes both ways. Some people had amazing pregnancies and amazing births, and they lived like a pinnacle time during their, let's say, their late pregnancy was just like this realization of their relationship, and they'd waited until they had a full career, and now they have this thing that they wanted so much. And then the fact that the recovery is difficult seems like a much steeper descent because it was such a pinnacle on the other side.
Okay.
And yeah, so I do tend to see that the emotional, mental, spiritual re-establishment. And, you know, what goes into that? So many things. You know, the kind of relationship you have. Are you giving birth in a familiar land? Are you giving birth? Not just giving birth. Are you becoming a mother in a familiar environment where you're supported? Is your own relationship with your mother all of a sudden been stirred up in a way that you didn't anticipate? And even if you know mentally, oh, my relationship with my mom's not that good, and I wonder how that's going to affect me postpartum and everything, it's still different than actually experiencing it viscerally. So a lot of times I feel like my job is listening in a really present way and show, you know, there's some exercises called the Rolfer control exercises from Janet Hulme, and she talks about the pelvic rotator cuff, and I've had really good luck with those exercises. But like all PT exercises and all physical therapy, it takes presence and it takes time. It's not like you just do them once and then, you know, I still do regular pelvic floor exercises, and I'm 8 years after having a baby. So it's actually just part of good women's pelvic health care. It's just something that isn't in the mainstream yet.
Right. And it takes time, you know, and it is, you know, speaking to that client that you worked with that in 2 sessions got the result that she was looking for. But as you said, you know, she laid a lot of foundational work by going to the PT for 4 months beforehand, working, say, on the physical element, and the result might have been not showing up until that healing was occurred, that she could then find herself in your capable hands and letting that last component be addressed and get that result there. So it really, you know, I would imagine that if she had seen you right from the get-go rather than doing the PT, she might not have gotten that result just in 2. It might have taken some unwinding. And to think that, you know, you can just go in and have like 1 or 2 sessions to have it all go away isn't probably necessarily realistic.
It really depends on the person. For some people, they're really clear and it really is just that thing. And then for other people, there's a whole lot of factors that are involved. I don't find that it takes tons of sessions, but I feel like, well, for instance, this person had lots of PT, but they never did any internal work.
Oh,
and
okay.
In my experience, the internal work is really important. And it's also very common that people have PT and it's just like half-hour sessions. And so in that half hour, they're getting what people describe as sort of like a targeted Pilates session on using the core, but they're not getting the actual internal work, which in my experience is sort of the game changer. Right. Revisiting the territory at the same time as there's a different level of awareness and consciousness, so that the unprocessed trauma or muscular tension or scar tissue can start to let go and things can start to rebalance.
Because so many women, in my practice, have been told that basically like surgery is the only option that they have. And I'm getting from this conversation that's not necessarily that everything can be fixed without surgery, but there's a lot more that can be done rather than just waiting for you to be a surgical case.
That's right. Definitely it's a last resort. And it's not a 100% guaranteed solution, and there's other complications that can happen from surgery. And I totally understand the desperation that a lot of women feel and like, okay, I just want to take care of this. But it's rebuilding a foundation takes time.
Right. And it sounds like a lot of the birth prep, getting your body physically and emotionally ready for birth is so important for so many different reasons. But then what I'm hearing from this conversation too is just how important that postpartum period is, to not just, because I think in previous conversations we've had and even on the episodes, I really even got the feeling of that kind of sanctuary time that you speak about, or the fourth trimester, or this time postpartum is kind of more of an emotional healing and a bonding with baby and reestablishing yourself as a mother versus just as an individual and partner. But there really is this physical component, which obviously has emotional components as well.
That's right.
Yeah. So what is a client when they come to see you for these type of things? What is the typical kind of assessment and like kind of care plan that you like to put together for people?
It's really individual, and it involves a body reading, looking at someone's posture, because how you carry your lumbars, how you carry your pelvis affects how the organs are sitting. And that was another really great piece of feedback I got from one client who had a really positive experience, was that she learned so much more about herself than just healing the prolapse. She realized that there were ways that she held herself and ways that her body related to gravity beforehand that predisposed her for those things. And so now she could get into some of the underlying foundational stuff. So it includes a body reading. It includes like I say that it depends on the person. I'm not trying to be vague, but if somebody has a lot of trauma and a lot of charge around their birth story, then I don't get into the whole story right away, because I don't want to reactivate that whole thing. So I've studied a bit with Pam England, who has the birth story medicine approach. And so if I feel like the birth story is a huge factor of it, then I do a birth story medicine session. And then as I do hands-on work, I include what I know about the nervous system and renegotiating within the nervous system as I'm working.
Okay. So it's both hands-on as well as, working with the birth story.
Yeah, there's talking and there's touch.
Okay.
And tracking, and then also coming up with a game plan. I'm not necessarily able to say I need X amount of sessions, but I am able, we're able to decide together, okay, let's do the exercises for 2 weeks, check in with me if you're not understanding them, and then come back and let's see how things are. Or sometimes right away people stand up and feel so much better, and they're like, I want to come back because this is the only thing that's helped. Or
right. So you're able to
and
give
I
them
have
that
an
game plan
ability
and then
to
course
put
correct as you go.
Yeah, and what I offer and what I'm hoping to train other people to offer is that I have the big picture. So a lot of times what people are doing is they're getting all these pieces and parts. They're getting a lactation consultant, and then they're getting therapy, and then they're getting postpartum PT, and then they're getting someone to deliver bone broth or whatever. And there's this scattered feeling already. And many people reflect back to me like, you're the first person that I feel like gets it. You're the first person who like gets all the pieces of the puzzle. So I have a way that I can listen to the whole situation, listen to the whole context and story, and be able to help the person parse out what exactly is happening. You know, I'm not afraid to say to someone, you know, this is the 6th time that you're coming to me, and it doesn't seem like the prolapse is healing in a way that's feeling feeling good to you. And what I want to talk about is the anxiety that you're feeling, because that's got to be making you much more miserable than the prolapse right now. And perhaps if we can resolve some of this anxiety, then the focus of all your attention won't be on the prolapse. And you know, the rest of your life can also be joyful, and give yourself the time and space for the prolapse to heal.
Right.
I'm not sure if that makes total sense, but I hope it does.
No, it does. Like what I hear from it is, you know, it is a very holistic approach that if someone might be coming into you specifically for the prolapse, and you might be able to, in your expertise, realize, all right, there's more than just the prolapse going on, and you want to address the underlying kind of most global pattern that might be able to produce the biggest shift. And that might be specifically what they came in for. It might be something that seemingly is different, but is also going to greatly benefit them. That's what I heard from it.
That's right. And then I have the skills to do that. So I don't have to say, you know what, I think that this birth is really having resounding effects in how you're feeling. And so I'm going to refer you to this other person. I'm able to say that. And that doesn't mean I won't do hands-on work. I mean, a lot of people are coming to me because they know I'm a body worker. So it wouldn't really be exactly ethical for me to just ignore the body work aspect of it. But, you know, birth tends to open up a lot. You know, it opens up. That's what a rite of passage is. It sort of throws everything up in the air in terms of identity. And when that happens, things don't neatly fall back into place a lot of the time.
That's so true.
And so part of the overall healing process isn't just narrowing in on one problem. It's like seeing the big picture and helping somebody reconstruct themselves in a way where they move forward more whole. And eventually, yes, those physical problems do resolve. I mean, I've actually had no cases where people had to get surgery after working with me, but that might happen in the future. I don't know.
Well, that's a very good, that's a very good outcome. That's great.
Yeah.
Yeah. Well, so how can people get in touch with you to, learn more from you and possibly work with you?
You can get in touch with me by writing me at kimberly@magamama.com. If you want to already start getting familiar with your pelvic floor, which is an amazing resource anytime in your life, whether that's before you get pregnant, during your pregnancy, or postpartum, then if you opt in on my website, there's a trail guide to your pelvic floor audio, and you can just sign up and get that. And pretty soon I'm going to have an online course to help support women through the postpartum period that has a lot of these exercises and information and just a general context about the importance of postpartum healing.
Okay, great. And I'll have links in the show notes and on the blog post page to all those things. One to your email address, so people don't have to write it down if they're driving in the car right now. But then also how to get that audio of the trail guide to your pelvic floor. That's an awesome offer. Thank you for providing that.
You're welcome.
All right. Is there anything in closing that you'd like to add as kind of a take-home for the women listening to this show today?
Yeah, what I want to say is that it's never too late. So I get so many emails saying, and it can be anything from, well, I'm 8 weeks postpartum, is it too late? Or it's a year and a half postpartum, is it too late? Or it's 8 years postpartum, is it too late? And the answer to all of that is it's never too late. The body and the mind and consciousness don't work in linear time like our mind wants to imagine it. And the body is remarkably resilient, and there's always possibility for total healing. And I've worked with people even 20 years postpartum where the injury is distinctly from scar tissue during the birth process, and it can resolve. So I just want to be a voice of hope in my own life that I've recovered in at a time. There's been many times in my process when I felt broken and discouraged and wondering if it was actually possible. And now I know through my own experience and from working with other women that it is possible. So it's never too late.
Good. And, Kimberly, again, thank you so much for being here and sharing this information. Again, like I said at the top of the episode, it's something that there's many women that are having challenges, and it's unsaid. It's not being spoken about. So I really hope that this audio is listened to a lot, and people are able to get in touch with you, whether or not they're able to, be on your table because they're in San Diego, or you're able to help them virtually, or point them in right directions and where they are in the world. So thank you again, Kimberly, for your expertise, and I'm enjoying having you back soon for another conversation.
Great. Thanks, Jay.
And something I wanted to mention very quickly before we close out the episode is Kimberly has an article on her website for those of you listening here that will help you if you are suffering with a prolapse. It's called I Have a Prolapse, Now What? And it's a step-by-step guide of what you can do to help yourself heal naturally if you're having challenges with a prolapse right now, and where you can get some more information and some practitioners that may be able to help you with it. So it's over on her website, magamama.com. I'll put the link in the show notes here in iTunes, but then also on the blog post if you're listening there, so that you can click right over and get that information as soon as possible.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.